COVID-19 rages across the United States as the number of people who've died from the virus in the country closes in on 400,000. Hello, I'm Anand Naidu and this is The Heat. While the last week here in Washington has been dominated by the attack on the U.S. Capitol and the impeachment of President Trump for the second time, the country continues to battle a COVID-19 crisis. The number of those dying from the virus across America is staggering, with the death toll now almost 400,000. And over the last week, the daily average of new cases being reported is around 250,000. More than 23 million people in the U.S. have been infected so far. To discuss the crisis situation, joining me now via Skype from Roxbury, Connecticut, is Dr. William Haseltine. He is a former professor at Harvard Medical School, and he is the chairman and president of Access Health International. With us too via Skype from Washington, D.C. is Gavin Macgregor-Skinner. He is an infectious diseases expert and director at the Global Biorisk Advisory Council. Also with us is Kate Tulenko. She is the CEO of the global firm Corvus Health. And here in Washington, D.C. too is Katie Barlow. The former journalist and lawyer is host of the Words Matter podcast. Welcome to all of you. William Haseltine, let me start with you. And as I said, these figures are staggering. They're alarming. The U.S. is averaging 250,000 cases a day. 38,000 Americans have died just in the first 2 weeks of 2021. And the CDC is warning that there could be up to 92,000 more deaths in the next 3 weeks. What's behind these numbers?
The first thing behind these numbers is failure to control the pandemic through public health measures. We have dropped the ball at the federal level, at the state level, and we've dropped the ball at the level of individual responsibility. That is what's behind this. Other countries have controlled the virus well. We seem to be in a position uniquely with Israel right at the moment that are in the most dire straits on a population basis. There are other countries not doing particularly well, but we're doing worse, and it's because of our failure to institute proper public health measures.
Is there a time in the near future, do you think, when we'll turn that corner? I mean, have we reached the peak right now, or could this even get even worse?
It's almost certain to get worse. The holiday travel infected tens of thousands, hundreds of thousands of people. They were warned it would happen. They ignored the warnings for the most part. And we and they are reaping the consequences. As I say, and will there be a rapid turnaround? No, there won't be a rapid turnaround. It's going to take a while for this to tamp down. Yes, we'll get over the holiday surge and settle in at a different number. But there's another dynamic which is happening in this country and around the world, and that appears to be new variants of the virus. Not only are they more transmissible, there's emerging evidence that they may be immune to people who have already been infected may not be immune, and vaccines, whether developed in China or the United States, may not be fully effective.
Kate Tulenko, there are more than 3 million cases that have been reported since the beginning of this year. Hospitals must be under immense pressure and strain right now. How is the country's healthcare system coping with this?
Unfortunately, in certain cities, it's not doing very well. For example, in Los Angeles, it can take several hours for ambulances to respond to a 911 call. In addition, the ambulances have been told to conserve oxygen, and that if they think a patient probably won't make it, to not transfer them to the hospital at all. We're also seeing COVID wards being set up in garages and parking lots and other facilities, and there's no way we can give the same quality of care in these types of facilities. We also don't have the number of therapeutics that we need. There was yet another study showing that some of these interleukin-6 inhibitors can reduce mortality by as much as 24%, and we haven't used the Defense Production Act to make these available to everyone who has COVID and needs it.
And what kind of pressure are the hospitals coming under, Kate, with people going to hospital with other ailments, other things that they are suffering from?
If you need to go to the hospital for a stroke, a heart attack, an injury, something else, you're not going to receive the same quality of care that you would a year ago. There's no doubt about it. Hospitals are overwhelmed, they're busy, they don't have the supplies they need, they still don't have the protective equipment they need. So it's going to affect what we call all-cause mortality. So not just mortality from COVID, but mortality from other things as well, such as heart attacks, strokes, cancer, and trauma.
Gavin Macgregor-Skinner, let's talk about vaccines. So far, 11 million people in the United States have received the first dose of the vaccine. There are about 30 million doses that have been distributed. Some states are talking about setting up mega vaccination sites. But what needs to be done right now to get more people vaccinated?
That's a great question, and we are setting up mega sites. So we're using convention centers, stadiums, and arenas. So I just a few days ago, I was working at a vaccination clinic that is using a stadium as a drive-through. We can do 260 cars an hour, about 1,500 a day, and that's it. We're maximum out. We need more people. And again, to understand how many people it takes to get the vaccine out of the ultra-cold freezer into where the vaccination site will be delivered, the person that has to be registered at the state level to actually do the injection, the ability to do the paperwork, and then the ability to watch that person for 15 minutes in case there's any adverse reaction. So right now, we need more people. In some of the counties that I work in, we're seeing so many of the community volunteer that is helping us accelerate the vaccination numbers each day.
Gavin Macgregor-Skinner, what are your thoughts on what William Haseltine just told us about some variants of this virus, which make it more transmissible on the one hand. On the other hand, they also may be resistant to some of the vaccines being produced?
This is a concern that all of us have. What we know here that in the US, we weren't doing enough genomic sequencing. That is that testing for looking for variants or mutations. Yeah. So when we saw the B117 variant strain emerge in England, got into London, became the predominant strain, and then we started looking for it here, and we didn't just find it in one or two states. We found it on the East Coast, the West Coast, down in the South. It was all over the country. We're now also looking for the South African strain. But one thing that I'm very concerned about is the news that's coming out of Columbus, Ohio, that in the past 3 weeks, there's a new mutation, a new strain up there that has at least 3 significant mutations in it that has now become the dominant strain in Columbus, Ohio. We don't have the answers just yet of how this will affect the vaccine, but now it's important to take those antibodies out of people that have been vaccinated and then challenge them against the mutation strain, the variant strain, to see how efficacious the vaccine still is, or whether we have to change. This is information research that's ongoing. We just don't have the answers right now.
Okay, one other development very quickly, Gavin. Johnson & Johnson, the big pharmaceutical company, is talking about a one-dose vaccine. What do we know about that?
That one-dose vaccine we're seeing go through the phase 3 trials, and the initial results that many of us have seen, we're very encouraged by. So we're seeing good phase 3 results at the moment. It would be a game changer for us at the moment. We're using the Pfizer vaccine and the Moderna vaccine. Pfizer needs to be given 21 days apart, 2 doses. Moderna is 2 doses, 28 days apart. The logistics is so challenging for us. Going to a one-dose vaccine is going to be a big game changer.
Right. William Haseltine, what are your thoughts on what Gavin just told us about this mutating mutating virus, rather, in Ohio?
Well, I've just written a blog on that for a media. It's a very serious issue. We are going to find many more variants of this in the United States. After all, we're the largest center of infection, and this virus changes. Let me point out there something else, though. We already know that there are virus strains out there that convalescent sera does not touch, or doesn't touch effectively, reduces the neutralization by as much as 60-fold or more. We know those mutations exist. One is in a Brazilian strain, one is in a South African strain, and there are other variants that have even, let me say, more sobering effects when you treat them with convalescent serum. So we already know this virus is mutating to resistant to convalescent serum. Will it be resistant to vaccine sera that in people who have been vaccinated? Possibly. We don't know the answer yet. And as the other gentleman said, we're looking at that very carefully. But this is going to be a long-term problem, not just for the United States, for the world. It looks like this is going to be more of a long haul, like the flu, coming back year after year with various variants. We had hoped this virus would be stable. It hasn't turned out. That hope has been dashed. It is not stable.
Okay, let me bring Katie Barlow into this conversation. Katie, of course, there is a big political dimension to this. We are in a time of change right now. Next week, at this time, the United States will have a new president, Joe Biden. He's already outlined a plan, a $1.9 trillion plan, and part of that, $400 billion, will be used to combat the virus. He's talking about an economic rescue package as well. What can we expect from Biden starting next week? How different will it be from what Donald Trump has been doing?
Well, to Gavin's point, they need more people to help prioritize distributing the vaccines. And part of the $1.9 trillion plan, one of the top 5 priorities that Biden has listed, is money that will go to vaccine distribution. We'll also see individual checks increase to citizens across the country up back to the $2,000 that was originally discussed in the Senate, $2,000 to individuals, a $1,400 on top of the $600 that's already gone out. We'll also see increased unemployment benefits and increased child tax credits and state and local government funding. State and local government funding is something Democrats have been fighting for in the Senate. Senate Republicans have balked at it at every step. And now that there is a 50-50 split in the Senate with Vice President-elect Kamala Harris casting the deciding vote, President-elect Joe Biden can basically write his menu that he would like to see move forward in a Senate now that he has basically the majority. And those 2 Senate seats that they just won in Georgia were hugely critical to that and him being able to implement his priorities in both combating COVID and distributing the vaccine.
Although, Katie, President-elect Biden may have some problems because, as you point out, it's 50-50 in the Senate right now. There are some wavering voices among Democrats, so he would have to seek the help of Republicans, wouldn't he?
That's absolutely right. And look, Joe Biden had 36 years in the United States Senate. That will be the most experience in the Senate that any president in U.S. history has ever had. And just as President Trump touts himself as a deal-making president, Joe Biden will tout himself as somebody who has experience on the Hill and somebody who knows how to reach across the aisle. That will be the type of president that he shapes himself as going forward. And so he'll look to folks like Joe Manchin, Chris Coons, who he has strong relationships with, but also Republicans like Senator Lisa Murkowski of Alaska, who is up for re-election in 2022, but she'll look to be able to help contribute to vaccine rollout and combating COVID. And he also has a strong relationship with Mitch McConnell, the outgoing Senate Majority Leader. Yeah. When Joe Biden was finishing his time as the head of the Senate when he was vice president under Obama, McConnell said on the Senate floor he trusted Joe Biden implicitly. So those words will certainly be tested in the coming days. But Joe Biden is not coming into this blind. He worked in the Senate for 36 years, and he has the experience to at least attempt to reach across the aisle. The question will be who will be receptive to that.
William Haseltine, that huge stimulus bill that we were talking about, $1.9 trillion that Joe Biden would like to pass, $400 billion of that would go towards combating the virus. What would you like to see Biden do?
Well, I think many of the things that I've seen now in that paper that he's put out that he'll be talking about are very positive. For example, I'm very happy he's going to be supporting rapid testing. I'd like to see that ramped up even further so there are free home tests, self-administered home tests that people can know if they're infected, so they know to stay home. They know if their family is infected. Schools know if any students are infected, and workplaces know if their workers are infected. I think that's a critical piece. But as I said at the beginning, the failure that we have had in the United States is a public health failure. It's a failure to do the simple blocking and tackling. If other countries have done better, China in particular, they followed the rule book that we wrote. I was a professor at Harvard School of Public Health. After SARS, many of the Chinese leaders came to the United States to learn how to control a pandemic. And they brought those lessons back. We even sent people to the Center Party School to make sure they had those lessons. They sought those lessons, they implemented them. Well, that's what we have to do. And we need the cooperation of our entire country. This does not happen because somebody in Washington says it should happen. It happens because everybody from the community level on up believes that public health is the answer. I think that medicine, we put too big an emphasis on medicine. Yeah, medicines are great. We need them. But we need to put this genie back in its bottle through public health control. And I'd like to see a much greater emphasis than I've seen in that in particular.
Tulenko, you know, it's been almost a year since this pandemic hit the world and the United States. We're hearing about this term, COVID fatigue. People are really, they've had enough of this. In many places, they're not observing social distancing. Restaurants remain open. We're also seeing students wanting to head back to college. Are Americans taking this as seriously as they should?
Well, I think the elephant in the room is that the U.S. is in the midst of a public health, mental health crisis. The combination of the chronic crisis that we've been in over a year. When you think about it, when there's a hurricane, an earthquake, it's over within hours or at least days. And this has been going on for about a year. Plus, we had the real shock last week of what happened on the Capitol, and a lot of people are reeling from that. And there hasn't been adequate outreach to help people identify sort of their shock and their mental health problems, seek care, or take care of themselves. And I do think that needs to be addressed. And yes, people are getting tired of not seeing their relatives or tired of not living their lives the way they need to. And we need to be able to teach people how to do those things in a safer way. Just to give an example, most Americans are still using a single layer cloth mask. We need to make better masks available. Many Asian countries have provided all their citizens with higher quality masks for free. We need to do that. We also need to push the vaccine down to the community level. I think stadiums and hospital vaccination has its place, but we need to be vaccinating people in the empty schools, in drugstores, even in firehouses where the EMTs and the fire people can give vaccinations. So I think there's a lot more that we can do to help people be safer as they go out along their lives.
Kate, one other thing, and that is Joe Biden is talking about reopening schools within 100 days of the passage of that stimulus bill, that $1.9 trillion stimulus bill. Is that practical? Can that be done?
I think it is possible. It'll be difficult, but if he can get every teacher who wants to be vaccinated, it might just happen.
Gavin, the last time you were on the show, the last time we talked about herd immunity, and we're told at the current rates of vaccination that it could be up to 3 years before we see herd immunity kick in. How does this work?
No, you're absolutely correct. We have to get a certain percentage. It may be, say, 60% of the population, depending on how dense that population is, whether it's a city or a country town. But we have to get a certain percentage of the population immunised, let's say it's 60%, to ensure that we start to break that cycle of transmission. Now, I've recently been involved in some of these calculations. Based on what we've done and where we've given the first dose and the second dose, based on the number of people, based on the number of doses that we can give each day, we're seeing some of the neighbourhood county levels, maybe they'll be able to do what they need to do in 6 months, or some 2 years, but the worst case scenario I've seen in some of the vaccination clinics, it's going to take 3 years. We can't do what New York City is doing, where they've gone to a 24 hours, 7-day clinic where I work, because we just don't have the people to do that. We're working 12-hour shifts at the moment, and at the end of that 12-hour shift, we're done. And if we make mistakes, we're going to screw things up more. So we've got to be really careful that people do need time off, as well as to keep working towards the mission of getting as many people vaccinated in every day that we work.
Katie Barlow, looking at the politics of this again, if we look at the last few years, in fact, the last couple of decades, politics has been very divided in the United States. The two sides are polarized. They're further away from each other than they've ever been. Do you think, with a new Biden administration, that the two sides can come together when they look at the gravity of the situation that the country is facing right now?
Well, they're going to try, and the first test is going to be right out of the gate in the Senate. And look, the Biden administration is going to need the Senate to walk and chew gum. They're going to right out of the gate have 3 different priorities. Because of the events of last week, they are now going to be grappling with handling a Senate impeachment trial of President Trump. At the same time, they are going to immediately need to focus on confirming President-elect Biden's nominees, particularly focusing on national security first as a priority. And then at the same time, they're going to have to deal with now President-elect Biden's $1.9 trillion proposal for COVID relief. All 3 of those things are going to happen at the same time in this highly polarized environment, to your point, Anand. And they're all going to have to work together to get it done. The Senate could not be more divided. It is literally 50-50. There's going to have to be reaching across the aisle from the Biden administration and from both sides of the aisle in the Senate. And they're all going to have to come together to get it done, to get this country through this crisis.
And in fact, the Democrats, Katie, have been talking about doing this piecemeal. On a certain number of days, you deal with the impeachment, and then on the other days, you deal with confirming the nominees that Biden has put forward.
Right. The Democrats would prefer to focus on confirming Biden's nominees and getting the COVID relief package through now that President Trump is out of office. He's not an immediate threat any longer, and so they can kind of kick the can down the road on a potential impeachment trial. I suspect that the Republicans may also want to throw the impeachment trial into the mix. It may be politically beneficial to them to help stave off the focus on some of the COVID battles that they're going to have to go through when it comes to numbers and what they'll actually agree to. So I think it's going to be tough, and I think impeachment is at least going to be on the menu in the first week. They're going to have to come to an agreement in terms of priority and scheduling and what comes first. And the Democrats do have the power there, even though the Senate is split 50-50, because Kamala Harris will have the deciding vote. The Democrats will have the majority, and they will be able to guide where the Senate goes. But they're going to need some Republicans on their side to get things done.
William Haseltine, getting back to the virus, there was a study done in the United Kingdom, a new study, which found that although those who have had COVID are likely to have immunity for up to 5 months, there is evidence that those with antibodies may still be able to carry the virus and spread the disease. What can you tell us about that?
Well, one of the big questions for the vaccination programs is we've seen that it's effective in reducing mild and serious disease and even death at this point. But we don't know whether it will actually stop infection and will stop transmission. There's hopes that it will, but there's no certainty. What we do know is people can be reinfected by viruses that are quite similar to the original virus. And now that they're variants, it's very likely they can be reinfected and may even get sick again, whether or not they're vaccinated. I think that, that changes our entire perspective, and it should change the world's perspective about how long we are going to be in the soup with respect to COVID-19.
And given those, yeah, go ahead.
Go ahead. No, go ahead.
No, I'm saying, given those changes that you were talking about, will we get to a situation like the flu shot that we'd have to get a new shot every year?
If we're lucky, that's where we're going to be, I think. And it may be every other year. We don't really know how long immunity lasts. I can say the cousins of this virus come back every year like the flu. And if you look at the cousins of the coronaviruses that cause cold, it looks like natural immunity may last about a year, and then it wanes and the virus can come back. And the patterns are almost identical to what you see with flu. So it looks like, contrary to what we were hoping, this virus is a change artist.
Kate Tulenko, looking at the current rate of vaccinations and the rollout, what is your best guess on what will happen in the months ahead in 2021?
Well, there are several states that have vaccinated less than 2% of their populations, but with the Biden administration really rolling out the vaccinations, giving money for the vaccinations, and the vaccinations being done at the community level, we know that Moderna and Pfizer are going to deliver 400 million doses over the next 6 months. So it might be possible to vaccinate every American who wants to be vaccinated over the next 6 months.
And how concerned should the country be over the fact that there are large numbers of people? There's one figure I saw which said that up to 50% of people would not accept the vaccine. They would not agree to be vaccinated.
It is concerning in that it means that we have to practice mask wearing and social distancing for longer. And I think as Dr. Haseltine was alluding to, we're going to end up with sort of a COVID tax. That every year we're going to have to spend billions of dollars on new vaccine development, vaccine distribution. People are still going to get sick, so billions of dollars in lost productivity, billions of dollars in hospital bills. So unfortunately, this tax, this COVID tax, is a new reality because people are refusing to wear masks and social distance and refusing to get the vaccine.
Right, Gavin Macgregor-Skinner, as this is a global pandemic. We've seen it. It's just gone around the world in such a short space of time. But as you look across the globe, what concerns you the most?
Right now, it's equity. Just because we can't measure equity doesn't mean we don't do it. And even now, what we're seeing now is we've gone through the first dose and second dose in the vaccination clinics that I'm working with. We're looking at who are we vaccinating, who has access to the clinics, and it's not equitable. And we're not doing a good job at identifying the more vulnerable people that may not have the socioeconomic means, the money, the transport means to get to the clinic, the ability to get on the internet to make an appointment. And again, they may have chronic diseases. They may be a cancer patient, a diabetic, and we're not reaching out to those vulnerable populations to decrease the burden off the hospitals in a way that's going to work. And we don't have systems in place then to ensure that those populations are being equitably given access to these vaccines. At the moment, it's a first come, first served basis.
But isn't there a system in place right now, Gavin? I mean, how do authorities reach out to people who need the vaccine? I mean, I've seen some states, for instance, in the state of Virginia, where I live, there's 3 separate categories of people who are going to be vaccinated: 1A, 1B, 1C. How are people informed about that?
You need access to the internet, and you need to be able to go onto an internet site, and you need to then able to register and get an appointment. The clinics I'm working in, no one can just turn up. They must come with an appointment. The challenge I had, and I was working with a family of doctors and nurses the other day, they made their appointments, but because of where they lived here and where I live in Washington, D.C., they were told to go to different clinics all over the city. And it just didn't make any sense based on the zip code where they lived. So at the moment, you need to have access to the internet, you need to have access to transport, and again, all of us are working 12-hour days right now. If I'm told to go and get vaccinated in the afternoon, I can't leave the hospital, I can't leave work. It has to be in a way, so we have to start bringing the vaccines into the place of work, whether it be school teachers, airports, or hospitals, so that we can actually facilitate and expedite this system.
Yeah, and I've also seen some reports about the fact that vaccines are actually being held up in warehouses. I mean, a lot of this has to do with logistics, getting it out there, getting it to people. But what do you know about that, about these vaccines that are basically stuck in warehouses?
A lot of information. We've been looking at this now since September of 2020, when we started to do drills and exercises based on that logistics was going to be our weakest area. It's going to be the biggest gap. It's going to be our biggest challenge, especially when we knew the Pfizer vaccine had to be kept at -94 Fahrenheit.
Right.
The Moderna vaccine at -4, but to get them out of those freezers into areas where we could, they come in those pizza boxes, into those clinics where we could hold them and actually administer them safely.
Yeah.
We need transport, we need refrigerators, and that's what we just didn't have them.
Okay, Dr. Haseltine, very quickly, I've got less than a minute left. You know, one of the questions I hear very often from people is this talk about returning to normality. When will the country get back to normality? Realistically, when is that going to happen?
We're not going to get back to normal life as we knew it before the COVID for many years. We're going to have to contend with COVID from whatever source. You know, this is a global disease. And wherever there is a center of disease, there is a threat of disease for all of us. We have to treat this globally. And that's going to take a long time. I would say my best guess to get even close to normalcy would be 2025.
And on that note, we have to leave it there. It's been a great discussion. Thanks to all of you for joining us. That is it for this edition of The Heat. See you next time.